Welcome back to Your Health Matters. My guest today is Dr. Robert Matheny, and we're talking about pulmonary hypertension and care. Thanks for being on the show, Dr. Matheny.
You're very welcome.
So we were talking earlier about the early symptoms of pulmonary hypertension. You mentioned shortness of breath in normal kind of daily activities. Anything else that we need to kind of be watching for?
You know, I mean, early on, those are probably the things that you're going to notice first of all, and things that should prompt you to get investigated.
Okay, and you're going to go to your primary care physician with that and show or talk to him about those symptoms, and maybe, like you said, mention that you saw this program or you've seen information on the internet, whatever, just to ask him to maybe look into that a little bit more thoroughly. So if you're diagnosed, you've got pulmonary issues, then what's the next step? What are the treatments for that?
Well, I mean, if you're or being identified or investigated for pulmonary hypertension, you're going to be into the care of a specialist. So at that point in time, you'll be seeing us in our office. It kind of moves out of the realm of primary care into something that we kind of have to manage. We'll do some things to verify what your pulmonary pressures are. We'll either do an echocardiogram to look at the pressures in the heart, or we might directly measure them by putting a catheter into your heart and measuring the pressure. And it's not quite as scary as it sounds to do that. But once we've done that, and once we see exactly what your pulmonary pressures are, then we'll usually initiate treatment. And treatment can vary from just treating the underlying cause and seeing how that helps you, or to actually trying to get those pulmonary vessels to relax. And we have some good medications for that now. A lot of research has been done, and a lot of drugs have come up in the last 5 to 10 years. As you heard, the erectile dysfunction drugs are important, and it's wonderful to have those because it's a pill.
So it's
I mean, you're taking it every day, which you're probably not doing for erectile dysfunction, but who knows, you know. But we have other classes of drugs that impact the walls of those arteries in the lungs and cause them to relax.
Okay.
There are some IV therapies that were also mentioned in the segue that you saw that some patients who are more advanced have to use, and they can either be pumped directly into the veins, or they can be put into the subcutaneous tissues under your skin. And we have patients here in Kingman that are receiving both of those kinds of therapy.
Okay.
And we're of course monitoring those patients really closely. And we follow those pulmonary pressures. We do clinical assessments. We do something called a 6-minute walk test. And surprisingly, that correlates very well with disease progression. We watch how far you can walk in 6 minutes, and then, you know, a month later we'll test you again. And a lot of times the patients are improving.
When they've been on the medications? When
they've been on the medications, they're able to tolerate more exertion. And the pulmonary pressures either begin to go down, or at least they stabilize. The progression of the disease is kind of slowed way down. That's great. So it
actually will improve quality of life.
It does. It really does.
And that's, to me at least, that's what it's all about, right? It's quality.
Right.
Very good. Is there anything else that you think people should be aware of when it comes to pulmonary issues?
You know, we do also have some pretty good support groups, which is nice to know. There are some support groups around the Tri-Cities area that you can become involved in. As I mentioned, you know, early on this was a devastating disease, and at some points in time it was actually even almost considered a death sentence.
Wow.
So a lot of the manufacturers of these drugs have helped to form support groups and give them support, and those people meet, and it can be a valuable resource for more information and for to get some questions answered. Oftentimes your physician's not the easiest person to get access to. So.
Well, and it always helps, I think, to know that you're not alone.
Right.
That there's other people that are kind of facing those same issues, and they can be a sounding block for you, and, you know, I've got, is this happening to you, kind of thing?
And and especially in a disease like this that can be a little bit scary.
Sure. Now, I know, are you referring to, like, I think here in Kingman we have Better Breathers that meet here?
That's a good support group for people with respiratory problems. There actually is a pulmonary hypertension support group as well.
I didn't realize that. Okay, so is that here at the hospital, do you think, that they meet?
No, it's in the, You know, I'm not actually sure where they're meeting at.
Okay.
But I know that it is a regional group. It is in the Tri-Cities area.
Okay.
So, yeah.
So would your office have more information about
They
that?
do.
Okay.
Yeah,
So,
they do.
so if someone has other questions, in fact, after this show, if they wanted to call to get more information, could they call your office?
Yeah, absolutely.
And what number would that be? You
757-3133.
call yourself very often? 3133. Okay, 757-3133. And that they could ask about the support groups as well
Ask
as
for information on a pulmonary hypertension support group,
Okay.
and we can get that for them. You bet.
Great, okay. I really appreciate this. Has been really informational for me as well. And I wanted to talk briefly, while we've got a few minutes left, about our hospitalist program that I know you're the director of as well, the medical
Right.
director here at Kingman Regional. And that's another program that can kind of be confusing sometimes, I think, for patients when because the hospitalists basically, a patient comes into the hospital and they don't see their regular doctor. They see a different doctor, a hospitalist, right?
Right.
Can you explain that program?
Yeah, you bet. This is something that's come about again over just the last few years, and the genesis of this was really based upon the need of the patients. When they arrive at the hospital, in the traditional model, you're still under the care of your community physician. Well, your community physician is usually pretty tied up in his office. You know, he rounds in the hospital, you know, when he can, you know, either at lunch or sometimes at the end of the day. He's not really involved in your care so much at the hospital as he's just trying to come in and, you know, manage things almost secondarily, and his focus is legitimately on managing his outpatient practice. He is, after all, a primary care physician. What has happened is we've realized that if we can develop these physicians who are specialists in hospital medicine, that's all they do is manage hospital patients. It improves accessibility to physicians for the patients while they're there.
Okay.
It takes the burden off of the primary care physician so he can really concentrate on what he does best. And it also allows the patients to have access to these doctors all the time. They're always in the hospital.
Because that's all they do is see
That's all they
patients
do.
in the hospital.
And the fear is for the patients that they're not seeing their doctor.
Right.
But in reality, the care is very coordinated. These hospitalist physicians don't have outpatient practices. So they are literally going to care for you while you're there.
Their focus is you.
Their focus is you. They're going to communicate with your primary care doctor.
Okay.
They're going to, when you're discharged, you're going to be discharged back into the care of your primary care doctor.
Okay.
And he'll know what happened, how you were cared for, what needs to be done. Any recommendations that are coming with you as you're discharged are communicated to him. It really allows for improved care while you're in the hospital. And there are a lot of secondary benefits as well. Because the care is delivered in a more timely manner, a little bit more focused, it also helps the hospital in terms of improving length of stay. Making sure the proper tests are done in a quick and timely manner. A lot of times it's just a little bit, you know, better care.
Well, and I think if there are issues, like you said, there's someone right there in the hospital that's able to be there quickly.
And it's worked out particularly well for us here in Kingman because, as you mentioned, myself and my partner, Dr. Wynn, are the directors, and we're critical care board certified physicians, and we're always available 24/7 as well. And as the directors of the hospitalist program, it's kind of comforting for our hospitalists to know that they have critical care backup 24 hours a day.
Right.
So we're kind of lucky that way too. So you can be assured that if you're admitted to CareMC, you're going to get top quality care while you're here.
That's great. That's being in the hospital is always a scary thing for anyone. So to know that you've got that kind of level of care has got to be a little bit more reassuring for those.
And you know, and I think that it's reassuring to the primary care physicians as well who utilize our service. Absolutely.
Well, thank you. I really appreciate you sharing all this information with us today, and maybe we'll have you back in the future to talk a little bit more. Again, the phone number for your office, if anyone has any questions.
757-3133.
3133, and they can always go to our website, azkrmc.com, because you and Dr. Wynn are both on that website as well. Find a physician, and they can learn more about the other services that we have to offer here at KRMC.
Great.
Okay, thanks again for being on the program, Doctor. Thank you all for joining us today, and I hope you'll join us again next week for Your Health Matters.